Greetings, greetings, Bob and Brad fans. Bob and Bad. It's bad here. Anyways, it is bad. Foot pain. Bob, we're going to talk about foot pain, the most 5 common foot pains that we've treated over the years. And we're going to go into the symptoms so that you can figure out what your foot pain is, and we're going to direct you on how to treat it as well. So
stick around.
Stand by. 9.2 seconds.
Bob and Brad, the 2 most famous physical therapists on the internet.
Okay, Bob, just a little brief introduction before we get into these. With foot pain, it's one of those things that's a compounding thing. If you have foot pain, you don't walk so well. If you don't walk so much, that can be a big part of your fitness.
Right.
If you don't get your exercise, you can get weight gain.
Right.
If you have weight gain, it can affect your mood as well as the fitness, which can cause depression. It's just bad.
It's a landslide.
It is. So if you got foot pain, we're here to show you some of the most common. Thank you. I don't want to make them popular. Now these are not in order, but we're going to give some stats. Number 1, plantar fasciitis. So that's pain in the bottom of the foot. Yep, Bob's got a bare naked foot to look
at. Right here, right where the heel is.
Right.
And it meets the arch.
Right. Now, as far as prevalence of this, about 1% of the people in the United States get this. That's 3.3 million people per year. The majority are ages 40 to 60. It's more common in males as well.
Wow, I didn't know that.
Yeah, exactly. Typical symptoms, like Bob pointed out, the location, oftentimes worse when you get out of bed and you initially put weight on that foot.
Right.
Ow. And then it improves over the, as you walk with it over the next 15 minutes or so. One thing that we're going to talk about, one treatment. We're not going to do a lot of treatment on all these because it would make the video too long.
Right.
But you can go to Bob and Brad YouTube and search any of these, and we do have wonderful videos.
We have a program
on plantar fasciitis, specifically, where there's a little library of videos specific to plantar fasciitis, and they all have a PDF printout, and they're all perfectly free. Absolutely nothing.
No email, nothing.
Now, I'm going to show you one treatment you can do if you have a massage gun.
Sure.
And the reason I'm doing this is because we're doing a giveaway.
EM19.
Yep. So you need a massage gun with a round ball, okay? And I just turned this one on, and this is the way I like to treat it. I don't like to go into that painful area straight on. You're just going to make it worse. You're going to beat up that sore, inflamed area. We're going to go sideways, and we're going to work that plantar fasciitis, start farther away from the sore spot, and then work your way towards it. When it gets real tender, you're going to stop. You don't want to beat it up, but you'll find out that you can increase the circulation, relax the muscles, the fascia, and
loosen up the tissues.
Yep, increase the healing with the use of massage gun. You can massage with your fingers and hands as well.
This is the EM19. We're giving away. It's actually the one we sell at Walmart.
Yeah, it is a nice gun. It works well for that. You can massage with your fingers and work circles and back and forth and splay. We do have videos on that. Your thumbs will get sore after about a minute or two.
So
very
go
good.
Like this. Thumbs to get sore.
Exactly. Let's go to number 2, Bob. Okay, bunions is specifically pain on the first MTP, metatarsophalangeal joint, which happens to be the big toe right here, and almost always is caused by footwear problems, inappropriate footwear.
Years of problems.
Right. And the thing is like with almost all of our footwear, toes come to a point. And it's a style thing.
They're too narrow.
Yep. Too narrow of a toe box, and then the point in your foot goes in there, and it squishes, literally squishes your toes together, especially if you have high heels or pumps or whatever they are.
Any heel can push you down.
Yep.
But high heels
are it's like a ski slope going down, pushing those toes in. And so you can imagine the most females are 10 times more likely
Right,
to have bunions
exactly.
than
Very
males.
common.
Yep. Some other stats, 23% of people between 18 and 65, and it's worse with people over 65, 36% have
That's
this.
a lot.
Yeah, it is. So there's a one treatment thing, and this is something that Bob, well, you didn't come up with this,
Right.
but your wife actually has used this successfully.
These just don't look pretty. They
Yeah.
actually serve a function. So these are toe spreaders. These are called what? Yoga toes.
Yep,
And she walks around with these in the morning
sure.
at home, and just it's been working great in trying to correct her bunions. She's got terrible bunions.
Right. So her feet are kind of squished together. These, once you get them in there, spread and stretch them apart, allowing those toes to breathe again, if you will. Not literally, but
Now
you
you
know,
got a pair that you can actually walk in, right? I mean,
walk
wear shoes
and
in.
run with.
Right.
Yep. So they're not as aggressive. They
Right.
have a lower profile. And that's another reason. And then along with that, you need, like Bob has a shoe with a large toe box. You want to
Right.
show that, Bob?
Yep.
And a zero drop.
So you can see the difference. Plus, it has less. It's got a flat heel.
Yep, exactly. I did want to mention, typically this is a visual deformity.
Right.
It's a little larger on that joint. It can be red, especially when it's inflamed.
And
So,
painful, right?
all right, very good. We're going to go on to number 3. Okay, number 3, we're going to neuropathy, peripheral
Right.
neuropathy. Usually it's below the knee. Symptoms are numbness, tingling, pain, and
Redness.
yep, and often associated with diabetes.
Diabetes,
Yeah,
right.
doesn't have to be though. Typically, the majority of people that have it are seniors or people, 60, 65 and older. Again, associated with diabetes. One thing that you'll want to do to treat this is activity. Increase the circulation. There's a number of ways to do
moving.
that. Make sure that you do not wear tight shoes, obviously. We talked about that with the previous diagnosis. Get your exercise. You can do massage with it to keep the circulation going. You can
Right.
massage by hand and work that. It's nice if someone else would
Right.
do that. Oftentimes, neither one of those works so well. And you can do. You can get a foot massager at
massager?
home.
Our office manager has one of these, and she has neuropathy, and she says it helped hers.
So yeah, and now in this foot massager, not only does it massage the foot physically, you can feel
It needs it and compresses it.
it
right?
compresses it, which
Right.
helps get the circulation going from the foot. Because you can get that swelling, that edema effect along with this as well. So that is very helpful
It's
for
got
that.
a bunch of different settings, so
Yeah.
you can adjust it to your liking.
Right. We also have a video on this. If you look on Bob and Brad on YouTube, we talk about some of the medical treatment, the medicines and whatnot from the pharmaceutical from Chris the
We
pharmacist.
covered all.
Yeah, it is. So we're going to go on to number 4. All right, the next one, Bob, is gout,
Yeah.
which is actually a form of arthritis, and it almost always presents itself with pain in
The big toe.
the big toe. Yes, the great
Very painful.
Yes. Now, this is quite a few people are diagnosed with this. 8% of United States citizens, that's over 8 million. Typically, more males have it, and it's more common with seniors by quite a bit. We've worked
Gotcha.
with, a lot of patients with that.
Right.
Things you can do at dealing with this is proper footwear. Make sure the footwear is not too tight. Once again, you may have some cushion in there. Diet is
Very huge.
very huge with this. We're not going to get into that with here. We do have a video that talks about it,
We
though.
did a video and asked our subscribers, and they told what bothered them.
Oh, yeah,
Yeah.
to get it from the
Right.
individual, because it is individual.
It is.
It's not the same thing for everyone. For sure, you want to get rid of the sugars and the
Right.
processed foods. And again, with gout, you want to keep that joint moving if you can. When it's flared up, you still want to move it. Motion is lotion. Don't
If
overdo
you can
it.
tolerate.
Yeah, exactly. So you may just work flexion and extension
And
up
there's
and down.
medicine, right?
Yeah. Oh, yeah. Yep. There's a way to treat that medically with pharmaceuticals as well. It's very point tender. So if you have gout, you've known it,
Yeah.
and so you need to get
You're
that
well aware.
diagnosed. Exactly
Right.
right. Very good. We're going to go to the last one, number 5, and probably the least of the 5.
common.
Yep. And number 5, we're going to talk about just arterial sclerosis
A fancy name
for plugged
for
up arteries.
circulation, right?
The arteries, and the reason I put this one on there, it's not, the numbers are not near so big. However, my father had this,
Right.
and he would go for a walk, which is real typical. Once you get some activity going, your feet start to hurt,
Right.
and it's easy to confuse it with, he thought he had flat feet, and he said his feet
Right.
break down, and I kind of tried to tell him it's probably
Circulation,
circulation. He was
right.
diagnosed with it. I never really got it through his head.
Right.
For him, his feet broke down and they were painful with walking, so he just did not walk as much, which can be a problem at least
Right.
the exercise.
Problems.
But typically, the arterioles plug up in this part
In the
where
calf.
there's a
Right.
part where the arteries bifurcate or split. That's where it oftentimes happens. So usually the calf gets sore as well as
the foot.
so they kind of work together. That is something you do need to see your doctor about. There can be a surgery for that. My dad was not a candidate for that, so that
Sure.
was the issue. It's an individual thing. There's medications that go along with that. Obviously, diet's very important, so you eat proper foods, all the
Right.
processed and high sugar type foods. So get that checked out as well. It's one that can kind of slip by, and people kind of don't get that.
Forget it.
Yeah,
Right.
or they think it's something else, but
Right.
it is definitely something to keep in mind. So there you go. 5 different foot problems, some of the symptoms, some of the cures, and or the treatments. And look up Bob and Brad, and we'll
And keep on walking.
keep exactly right, Bob. It's very important. You know, my dad was a postman, and he won the 1,000,000-mile walk. He didn't win it,
Wow.
but he achieved 1,000,000
He
miles.
achieved
For
it, yeah.
33 years, he was
A
walking.
million miles.
Yeah, it's a
Wow.
lot of walking. You should see his shoes, man. Heels would be
Ah,
wore off.
that's
Yeah,
right.
he wore them right down to nothing because, you got to get your money's worth.
All right.
Take care.